Coronavirus, obesity increase COVID-19 complications. This video is brought to you by HealthyRN Ways. Obesity is a common, serious, and costly chronic disease. Having obesity puts people at risk for many other serious chronic diseases and increases the risk of severe illness from COVID-19. Everyone has a role to play in turning the tide against obesity and its disproportionate impact on racial and ethnic minority groups. Carrying extra weight is associated with various chronic diseases that may make you more likely to face complications from COVID-19. Even in young people, having a high BMI is a risk factor for health issues from COVID-19. Those who deal with obesity are considered at greater risk for a range of health issues, from chronic disease and infection to slower wound healing. Now, early data suggests there's another health risk to be aware of. Increased complications from COVID-19, the respiratory disease caused by the novel coronavirus. Obviously, there's a great deal we're still learning about this virus, and these are preliminary studies. We're hearing that patients with obesity are experiencing more severe complications at a younger age, and that's a concern. Here's how taking small steps can improve your weight and potentially your respiratory health and other related illness. 2. Excess weight make COVID-19 more severe. Obesity and being overweight automatically put someone at greater risk of COVID-19 complications. There are factors in play with these conditions that make adverse outcomes more likely. For people with obesity tend to have underlying conditions that are already associated with greater COVID-19 risk. People who have heart disease, chronic lung disease, diabetes, and liver disease are among the individuals who fall into this category. Obesity should be considered a significant determinant of risk for severe COVID-19 related. One reason obesity raises the risk of serious illness from COVID-19 is that extra weight compromises the lungs' ability to do their job. Any disease that has a respiratory element to it, like flu or pneumonia, tends to be more severe with obesity. Another issue is that obesity raises inflammation levels in the body. Those with obesity tend to have more inflammatory cytokines, which are small proteins that get released during an infection. That inflammation is associated with other disease processes that are found with obesity, and it all ties together to increase risk, because it's impacting immune function. Type 2 diabetes and high blood pressure are the most common comorbidities in patients infected with the new coronavirus. These patients often don't have a lot of immune resources in reserve, so the response can be dramatic. Certainly, there are lean people who have a significant cytokine issue, but we just see it more often with those who are obese because they tend to have more underlying health conditions. These factors can affect those with obesity at younger ages, and that may be a major reason why hospitals are seeing younger patients with severe COVID-19. When you have these underlying conditions, you're at greater risk, so being younger is not protective. It is unclear whether obesity is an independent risk factor for COVID-19 complications. To learn whether obesity can increase health risks without other underlying conditions present, more studies are needed. Dealing with obesity: what to do. Whether or not you have other conditions, getting your weight to a healthier place is a worthwhile effort, since having a healthy BMI is associated with lower overall health risks, both mental and physical. Right now, with widespread stress and anxiety, as well as limited mobility because of social distancing recommendations during COVID-19, it may seem more challenging to adopt healthy behaviors that are associated with weight loss. Think of extra precautions, like staying home when you can, and weight management as self-care. This could be a time when you have the opportunity to change habits in a way you may not have had before. That might mean stocking your pantry with healthy foods and cooking more than you ever have, or it could mean moving more, or getting more sleep. All of these add up to benefits. People who cook more often at home tend to have healthier overall diets without an increase in costs. Sleep quality is another important factor, especially because people with obesity often have sleep disorders such as sleep apnea and insomnia, previous research has found. That can run in the other direction as well, with some past research associating poor sleep with impaired appetite regulation and metabolism, making you more prone to gain weight. It's also important to address any underlying health conditions that may be related to obesity, such as high blood pressure and respiratory issues. Talk with your doctor about managing these conditions, and stay on top of your treatment, for instance adhering to medication schedules. Obesity is a complex disease that may be associated with both nature and nurture. That means you may have grown up in an environment where highly caloric meals were the norm, and emotional eating could have come into play. But there are also some genes that have been associated with obesity, usually severe obesity, such as one known as the fat mass and obesity associated gene. The gene is found in up to 43% of the population, and can trigger increased calorie intake, reduced control in eating, and even a later likelihood of sedentary behavior and storing of body fat. But keep in mind that genetics are not destiny. Just because you have a certain gene doesn't mean it will express itself, and even if it does, there can be ways to minimize the impact. Regular exercise can lower obesity risk, even for those genetically predisposed to weight gain. Genetics and your food environment growing up are powerful factors when it comes to obesity, but they're not insurmountable. One more thing to keep in mind: taking these small steps is worth it. It doesn't take much weight loss to make a difference in lowering your health risks. Just 10% loss of your body weight is enough to have an impact on some of that inflammation. That's the point where we start to see some real changes and momentum. No matter what your weight, taking steps like these, especially exercise, which may reduce risk of COVID-19 complications, can be helpful for lowering inflammation and improving immunity. As the pandemic continues into cold and flu season, that can be a big plus for keeping yourself healthy and strong. Obesity worsens outcomes from COVID-19. Having obesity may triple the risk of hospitalization due to a COVID-19 infection. Obesity is linked to impaired immune function, decreases lung capacity and reserve, and can make ventilation more difficult. As BMI increases, the risk of death from COVID-19 increases. Steps to take now: systemic change takes time, as does long-term weight loss. In addition to the steps everyone should take to slow the spread of COVID-19, individuals can help protect themselves and their families during this pandemic by eating a healthy diet with plenty of fruits and vegetables, lean protein, and whole grains, as well as the appropriate number of calories is important for your health, and can help with weight loss and preventing weight gain. Good nutrition can help support optimal immune function. A healthy diet can help prevent or support self-management of diseases such as heart disease and type 2 diabetes, which also increase the risk of severe illness from COVID-19. Being active, regular physical activity helps you feel better, sleep better, and reduce anxiety. It can also help with preventing weight gain, and when combined with calorie reduction, helps with weight loss. Physical activity can also help prevent diseases that increase a person's chances of having severe illness from COVID-19, such as heart disease and type 2 diabetes. Emerging research suggests it may also help boost immune function. Getting enough sleep. Insufficient sleep has been linked to depression, as well as chronic diseases that may increase the risk of severe illness from COVID-19, such as heart disease, type 2 diabetes, and obesity. Coping with stress. Stress during an infectious disease outbreak can sometimes cause changes in sleep or eating patterns, increased use of alcohol and tobacco, or worsening of chronic health problems. Over time, these actions can help individuals with obesity improve their overall health. And if they result in even modest weight loss, there are health benefits, such as improvements in blood pressure, blood cholesterol, and blood sugars. And with a lower BMI, the risk of severe illness from COVID-19 is reduced. Bringing communities together to plan and carry out local, culturally tailored interventions to address poor nutrition, and physical inactivity and tobacco use. Promoting healthier food and beverage choices in childcare, schools, workplaces, hospitals, and public venues. Making healthy foods more available by connecting local producers with retailers and organizations such as childcare, schools, hospitals, and food hubs. Promoting nutrition standards in early care and education settings, food pantries, and faith-based organizations. designing communities that connect sidewalks, bicycle routes, and public transportation with homes, early care and education settings, schools, parks, and workplaces. Ensuring screening for obesity and access to healthy lifestyle programs for children and their families. The epidemic of obesity is impacting the severity of the COVID-19 pandemic. Given the added risks associated with COVID-19, we need to support all individuals, especially members of racial and ethnic minority groups, to live active healthy lives. Please like, share and subscribe to my channel. Thanks for watching. See you on my next video. Ma salam.